The vision of the Perinatal Foundation is to be the leading philanthropic organization promoting excellence in perinatal health care of women, babies, and families. The mission of the Perinatal Foundation is to secure new resources, conduct needs assessments, partner with the Wisconsin Association for Perinatal Care, and support successful programs and education models. Since 1985, the Foundation and WAPC have worked in partnership to improve the lives of mothers, babies, and their families. Sharing common values, the Foundation provides resources, and WAPC contributes the expertise of its volunteers. This partnership focuses on improving perinatal outcomes for all. With the leadership of obstetrician-gynecologist Tom Leonard and nurse midwife Helen Callan, the Perinatal Foundation and WAPC began a rich history of programs and joint initiatives to improve perinatal outcomes. Some of the joint initiatives include education and social marketing about postpartum depression, Peridata.net, recommendations for laboratory testing during pregnancy, fetal monitoring, preconception and interconception care, and newborn hearing screening. Education about postpartum depression has been a program focus for nearly 10 years. It started with a public awareness campaign, You Can't Tell by Looking. The most recent phase of the project is the Madre y Esperanza project, an outreach effort to educate Latino families about postpartum depression. In 2010, the Foundation created a CD about postpartum depression, with a radio novella and music. With academic and community partners, the Foundation began evaluating the CD to learn if it increases awareness, prompts affected individuals to seek care, and reduces stigma. Latino parents were recruited from computer classes and play and learn groups. Watch for evaluation results in the coming months. Another significant collaborative project is the web-based perinatal data platform, Peridata.net. Birth hospitals began using Peridata.net in 2006. Today, there are 85 of 100 birth hospitals using Peridata.net. These hospitals account for over 91% of births in Wisconsin. The latest accomplishment is the premiere of aggregate reports, which allow hospitals to compare themselves to other similar hospitals. All data are de-identified and aggregated. WAPC, with Foundation support, published the first edition of Recommendations for Prenatal Laboratory Testing During Pregnancy in 1997. The WAPC Prenatal Testing Committee made subsequent revisions in 2000, 2006, and most recently in 2011. The draft 4th edition was presented last year. Prior to publishing in 2011, WAPC made a number of revisions, most notably to incorporate newly released CDC recommendations about sexually transmitted diseases. The 4th edition is available for purchase at the registration desk and online at www.perinatalweb.org. Another collaborative project is the Fetal Monitoring Curriculum and Interactive CD-ROM, and in 2011 the Fetal Monitoring Lunch and Learn sessions. The noon-hour sessions began in February and run through December. Over 200 people are enrolled in the sessions, making these the most successful online educational venture to date. In 1994 and 2007, with funding from the Perinatal Foundation, WAPC produced educational videos about preconception health. The 2007 version was the subject of a plenary session at the second CDC Preconception Summit held in Oakland, California. Other successful initiatives included grants to small hospitals to purchase hearing screening equipment, Foundation grants for equipment, and WAPC education about hearing screening made newborn hearing screening a standard of care in Wisconsin. In 2011, the Foundation is launching a focus on fathers, Fathers Matter. It will be a series of activities beginning with a luncheon discussing the evolving role of dads in childbirth and child-rearing. The event will include a Fathers panel and a presentation by author Judith Levitt. The luncheon will be held on June 24th at the Madison Concourse Hotel. Look for details on the Save the Date card at your table. With the great need to improve birth outcomes, the Perinatal Foundation and WAPC are committed to continuing their partnership to create innovative programs and projects to improve perinatal outcomes and decrease disparities. In keeping with our focus on improving outcomes, we are proud to welcome Dr. Rosemary White Trout, presenting on developmental interventions for at-risk infants.